The greatest impediment to human flourishing really relates to social inequalities, as well as limited access to quality health care. What is necessary, particularly in the case of maternal and child health, is that women of reproductive age have the services needed to provide for a healthy pregnancy and to support the full flourishing of a fetus that will grow up into a healthy childhood and subsequently an adult. The unequal distribution of resources that would support human flourishing is really at the core root of so much of the health disparities we see across the world. This morning, I tried to bring light to the fact that we have really an unconscionable high rate of maternal mortality in the United States in particular that is distributed disproportionately among Black American women, Native American and Native Alaskan women. The fact that African American women have a maternal mortality rate that's 3 to 4 times higher than their white counterparts is really an unconscionable public health measure that highlights the importance of inequality and injustice, social injustice around maternal health. The Harvard Chan School of Public Health is a school that is focused on trying to align skills with vision of providing global health equity. At the School of Public Health, we believe that as a school, we are engaged in enabling and empowering generations after generations of public health leaders to support, to enhance, and to promote health of populations everywhere. What I get hope from is the fact that you would have individuals from the faith community, public sector, private sector, and academia coming together with an understanding that there is an obligation for all of us to take knowledge and push that knowledge out into action. Action that's going to bring about an attenuation of the inequalities that we see across populations. The Humanity 2.0 laboratory is a particularly fascinating experiment in that its objective is to really bring to action the work that will close the gap. The combination of collaborators across all of the sectors, the faith community, the business community, academia, as well as the government sectors, is really how we're going to be able to move the needle. The problems that we're facing in maternal mortality are complex. They are social determinants of health. They're also the lack of political and social will to make the investments in bringing down inequality. And I think the laboratory is a place that is going to put an accent on wellness. And by doing so, there is a stronger investment to prevention, protecting, and promoting human health. You know, I have been a maternal and child health researcher for 30 years, and there's a lot of hope. We have a lot that we can do to reduce health disparities, and it's this kind of convening, this kind of demonstration of collaboration that gives me hope that we'll apply the knowledge that we have in ways that will eliminate health disparities. I have a lot of hope because of the partnerships that come together and become effective because of these kinds of meetings.